We gonna discuss about tympanic membrane. What do you think about tympanic membrane? Yeah, thinking. What's there to think? It's a part of external ear, right? Yes. Before starting the video, I would like to ask you a question. By seeing into this picture, can you name like which side does this tympanic membrane belong? Yes. Yes, you'll come to know after this end of this video. I would like you to just look into this picture, like how it is, like where it is thin. Is it opaque or transparent or translucent? It is thin or thick. Yes, tympanic membrane. Tympanic membrane, you all know the development. It is developed by three layers of embryonic disc, that is ectoderm, mesoderm, and endoderm. It forms the partition between the external auditory canal and the middle ear, as you see. Yes, this is the tympanic membrane, where is the external auditory canal and the middle ear. It is separating. It forms the partition between the external ear and the middle ear, right? Yes. It's pearly gray and translucent. Yes, you see in the picture. Yes, it is pearly gray and translucent. And the structures, the middle ear structures that appear through the tympanic membrane is the malleolus. Yeah, you're all seeing the handle of malleolus and incus epithelial joint and the shadow of round window. Yes, the shadow of eustachian tube is also appear, but it's a rare actually. Yeah, it is obliquely set, and as a result, its posterior superior part is more lateral than the anterior inferior part, as it makes 55 degrees with the horizontal. And the dimensions are tall, wide, thick. Yeah, you can see. As you see, this is the tympanic membrane, like external auditory canal. The tympanic membrane is placed obliquely so that it makes 55 degrees with the horizontal, so that its posterior superior part is more lateral than the anterior inferior part. Okay, this explains the point. And it has three layers. Yes, the outer epithelial layer and middle fibrous layer and inner mucosal layer. Outer epithelial layer continues with the skin lining the meatus, and middle fibrous layer continues to encloses the handle of malleolus, and that forms the radial, circular, and parabolic fibers in the pars densa. Inner mucosal layer, it continues with the mucosa of middle layer, and this fibrous layer actually is thicker and it is well developed in pars densa, where it is thin in pars flaccida. uh, this pars densa, pars flaccida, what are those? Yeah, those are the parts of tympanic membrane. We'll discuss those in detail. Before going into the parts, before going to discuss the parts of tympanic membrane, I just want you to know about these terms: annulus tympanicus, malleolar folds, tympanic circles, cone of light, and notch of Rabinus. Yes. What is this annulus tympanicus? Yeah, I have said that this fibrous layer is actually well developed in case of pars tensa, right? Thickening of the fibrous layer all around the pars tensa is called annulus tympanicus. Yeah, you can see here. Thickening of fibrous layer all around the pars tensa is called annulus tympanicus. And this where it fits is called tympanic sulcus. Yes. And what are those malleolar folds? As you can see, this malleolar folds are nothing but here. The thing here, the folds which it is attaching to the lateral process of the malleolus. This is the lateral process of malleolus, and these are the malleolar folds, and it is divided into the anterior malleolar fold and the posterior malleolar fold. We discussed about annulus tympanicus, tympanic sulcus, malleolar folds. And coming to the cone of light, this is the cone of light. Importance of cone of light is, by seeing this cone of light, we can see, whether we can say whether the tympanic membrane is belonging to the right ear or the left ear. If it is right, it is right side ear, and if left, it's part of left ear. Okay, that's the importance of cone of light. And coming to the notch of Ravenous. Tympanic sulcus now. This tympanic sulcus is present all over the pars tensa, where it is absent in the pars flaccida. So that is called the notch of Ravenous. So this is called the notch of Ravenous. Okay. Um, we all know the terms. So let's discuss the parts. So the parts of tympanic membrane. Pars tensa. forms most of the tympanic membrane? Yeah, we have seen it. This is the pars tensa. This lower two-third part is called the pars tensa. Forms most of the tympanic membrane. Periphery is thickened to form fibrocartilaginous ring called annulus tympanicus. This annulus tympanicus, which fits in, called the tympanic sulcus. Okay, umbo. Yeah, umbo is nothing but the part where this handle of malleolus making the concavity here. This is called the umbo. Okay. Yes. The central part of pars tensa is dented inwards at the level of the tip of malleolus called umbo. And the bright cone of light can be radiating from the tip of malleolus to periphery in anterior inferior quadrant. Yeah, yes, this tympanic membrane now, it is divided in the four quadrants where it belongs to the anterior, inferior part. Okay. Pars flaccidias, it is situated about the lateral process of malleolus between notch of ravenous and anterior posterior malleolar folds. It appears slightly pinkish as compared to the pars densa. Yes. This is also called as Sharpan's membrane. Yeah, we discussed about the parts, layers. Yeah, that's now supply. Anterior half of lateral surface is supplied by the auriculotemporal nerve, and posterior half of lateral surface is supplied by auricular branch of vagus nerve. Medial surface is supplied by the tympanic branch of cranial. So, if they ask you to draw a picture in the examination, you can take this as a reference. Okay, that's about tympanic membrane. We discussed about the introduction part, the layers, the parts, and some terms, and nerve supply, and the diagram. This is about the tympanic membrane anatomy.